And thank you to Minister Rabbitte as well for coming in today to address this important issue. Minister, I am glad that this issue has been selected as a topical issue this evening, and I thank you for taking the time out to respond, as this is an issue I have been raising for a number of months now, and I would be interested in hearing the Government's plans or intentions for the rollout of rapid antigen testing. The World Health Organization and the European Commission recommends rapid antigen testing that meets the minimum performance requirements of greater than 80% sensitivity and 97% specificity. A number of rapid antigen testing products currently in use in the country far exceed these requirements, the Roche test and the Abbott test being two of the more prominent ones. Rapid antigen testing should be administered by trained professionals. The nasopharyngeal sampling requires it. The rapid tests could be conducted on-site, in pharmacies or in local health centres. People's results can be uploaded to the Health Passport Europe platform, which can be used for receiving and displaying COVID-19 status and certification. This technology is there. It is being used in the corporate sector, in many pharmaceutical companies and multinationals as we speak, in the food processing sector and indeed in the construction industry. This rapid testing technology is being used at the National Children's Hospital construction site. Indeed, I have been informed that the screening taking place in some of these businesses and sites that I have mentioned have actually detected COVID-positive patients before they entered the workplace. I have been told that 4 COVID-positive workers were detected recently at the site of the National Children's Hospital, and rapid antigen testing was key to identifying these cases early and subsequently isolating those affected and obviously having no knock-on consequences for that site. Rapid antigen testing can complement the existing PCR testing we have. It is not intended to replace PCR testing. It can play a pivotal role in screening and detecting COVID-positive patients, but it can also give certain sectors hope. Hope that their businesses can reopen, hope that they can attend necessary appointments, and hope that they can spend time with their loved ones. Moreover, rapid testing can provide protection for people in the workplace. It can help protect our frontline staff as they deal with the wider public with appointments, surgeries, medical emergencies, etc. I want to reiterate that this is not a panacea that will solve all our COVID-related problems, but it will complement the PCR testing we are already doing. I urge you, Minister, to relay what I am saying both to the Minister for Health and indeed Government. Health screening can give our country greater confidence and some reassurance that there is a way out of this. The investment required to do this could be minimal. Many companies are doing it themselves anyway and are leading on this. It's time that we look into this as a tool to strengthen the measures we are already taking in terms of vaccination and no quarantining. Thanks.
Thank you very much, Deputy Minister Rabbitte.
Thank you, Ciarán Comhairle, and I want to thank the Deputy for raising this important issue here this evening, and I'm taking this on behalf of Minister Donnelly. Testing and contact tracing continues to be the fundamental to our response to the pandemic and is critical to ensuring that we can identify and contain the spread of the virus. The HSE has adopted the RT-PCR as the gold standard test for diagnosing COVID-19 cases, and this is the most reliable test that we have available for this purpose. In addition, appropriately validated antigen diagnostic tests are now being deployed by the HSE as a supplement to PCR testing, just like you have referred to there, Deputy. These tests are being used to specific indications in acute hospital settings as part of the response to outbreaks in the community setting, particularly in symptomatic vulnerable populations and for those close contacts. Antigen detection tests, or ADTs, are described as rapid and simple to perform. The validation work that has been done by the HSE and across Europe to date indicates that ADTs are most effective in detection of symptomatic cases when symptoms onset is within the last 5 days and when the likelihood of the test positivity is greater than 10% among the target population. The validation studies available show significant disparities in test performances versus some manufacturers' claims. Many of the tests available do not meet the minimum performance requirements set out by the WHO or the European Test Centre, and in response to that, Deputy, that is a general response, not in relation to the specific tests that you are actually referring to. This means that the tests that are currently available are limited use in most circumstances when testing asymptomatic population, and it is also clear that new tests and new technologies are becoming available every day. Considerable work has been undertaken to date to evaluate the use of ADT in an Irish context. While antigen testing will not replace the requirements for the large-scale RT-PCR testing for public health purposes, validation of tests is continuing in the HSE due to the potential role that ADTs have in our national testing strategy. Consideration is also be given for the use of antigen tests in asymptomatic community populations. Professor Mark Ferguson, the Government's Chief Scientific Advisor, has been asked by the Minister Donnelly to set up a group to examine the use of antigen tests in the community, and further expert advice is expected shortly to inform us further on the potential of these testing technologies. While we have more tools at our disposal, it is clear that we need to deploy existing tests appropriately and be guided by scientific evidence in doing so, particularly since we are aware of the limitations of many of the tests that are available. And I wish to assure the House that the national testing policy is kept under continuing review, and we will use whatever tools are appropriate to fight COVID-19. So I hope that addresses some of Deputy O'Sullivan's queries.
Minister Abbott. That's very good. Deputy O'Sullivan.
And Minister, look, I would welcome that Professor Mark Ferguson, the Government's Chief Scientific Advisor, is being asked, I suppose, to keep this under review. I suppose that is welcome, but I think we need to have a bit of ambition. The two tests that I did mention, the Roche test and the Abbott test, do meet the minimum standards, and I suppose if we are to give people hope, prospects of what can come down the line post-COVID, or even as we do the vaccination rollout, this is pivotal. People can possibly, if they're going for a medical appointment or a dentist appointment or whatever the case may be, a PCR test as you arrive, maybe half an hour before your appointment, that could provide a lot of, I suppose, reassurance, not just to the patient but also to the staff that are administering those, that are attending those clinics. So, look, I welcome the fact that Professor Ferguson is keeping it under review, but I do believe that we need to do more, especially since the vaccination rollout. It is a fluid situation. There possibly might be more speed bumps down the line in terms of the rollout of the programme itself. And I think that this would give people a light at the end of the tunnel, some hope, some prospect of some return to some bit of normality. I just emphasise again that this is not about replacing PCR testing. This is about complementing it, and I think the more people we test, whether it's through PCR or whether it's through rapid testing, the better. And I suppose I just point to the case of Liverpool recently. They did daily rapid testing of the city, and I believe that they tested over 200,000 people out of a population of 500,000 that were identified. And of that 200,000, of those 200,000 rapid tests conducted, 4,000 people were found to be asymptomatic, carrying the virus unbeknownst to themselves. And because of the rapid test that was being rolled out there daily, those people were identified and then able to isolate. So, as I said, this isn't to replace the system we have. PCR is the gold standard, as you said, but I do believe that there is a place for rapid testing, and I believe that the HSE can give guidance. The HSE can, publish guidelines and let companies and providers out there provide these tests to people, because there is a demand for them. And as I said, it's happening all around us in major pharmaceutical companies, major multinationals. This is happening. It's about time, I think, that we moved with it. Thanks, Cathaoirleach.
Thank you, Deputy Minister, to conclude.
Thank you, Ken Corlin, and thank you, Deputy O'Sullivan. And it's interesting we're having this conversation here today, because only last week I met with Paul Reid and Colm Henry in relation to it. The week before, myself and Minister Donnelly had a long conversation around it. Yes, it's a complementary tool, and as vaccinations is being rolled out, I think it's very imperative that we also have backup alternatives as we're reopening society and giving that hope that you talk about, Deputy O'Sullivan. And when I think about it, you also have to think about the opening up of society in relation to the likes of the student campuses campuses again. We need to have something that we can use, and in all fairness, that's what this whole antigen testing is about. And I have to compliment Minister Donnelly with the appointment of Professor Mark Ferguson, who is set up with the task of reviewing this. And I think that's the one thing about the current rollout at the moment of the vaccination programme, and we've seen it in how NIAC have responded to the various different groupings that needed a second relook over. That is exactly what is happening here in relation to antigen testing. It's how we can use what tools we have available to us to ensure that we can continue to function as a society when the vaccinations start, that when we open up, that there is not only just hope given, but there is an assurance that we are able to respond, go in, do that test that's required, and actually lock down sectors. And when you talk about various parts, meat plants comes to my mind in exactly how that can be done, or small communities where 1 or 2 cases could pop up by having that rapid antigen test. So, Deputy O'Sullivan, it is very much to the forefront of Minister Donnelly's ambition as Minister for Health in reviewing the rollout of antigen testing as well.